Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. Did Texas make a mistake? Did they pass legislation that actually hurts rather than helps? I'd like to thank Leslie Shields for pointing this out just a few minutes ago before I went live about Senate Bill 51. And this is in your Monday morning news, so please take a look at it if you are in Texas, if you are licensed in Texas. What this bill says is that once you terminate someone off of a group plan, the plan doesn't actually, that coverage doesn't actually end till the end of the month. So your employee actually terminates 11/30. But you do not terminate them to 12/1. That coverage stays into effect until 12/31, and the group is responsible for that premium. Now let that sink in for a minute. I was given an example where the employee terminated. The employer, of course, was into the next month terminating the coverage. The child was scheduled for a very serious surgery as a charity patient because they didn't have insurance. The surgery was canceled because the insurance is still in effect. Shouldn't be in effect. I'm going to look into this more, take a look at the actual law, make sure that Texas is, that Blue Cross of Texas is actually reading this right. If you know of anything, if you heard of anything, if this has affected you, please let me know. This is something that the media needs to know about because folks are going to be hurt. Small businesses are going to be responsible for premiums that they wouldn't have otherwise. And in the case of this baby, you know, or there going to be life-threatening situations. Very, very important. This is one that got past us. Not sure where it came from. Haven't been able to follow the money yet, so I'm not sure why, when, but I'm going to figure it out. I always, you know, think of things that make me go, mandates. States continue to pass mandates. And with the passing of the ACA, the mandates are paid by the state. Any mandates after the fact, after the ACA was passed, the state is responsible for paying for those mandates. So I try to make sure legislators understand that you're passing laws and the state's going to have to pay for it out of their budget. And then, you know, their question is, well, insurance companies are not at the table. They're not testifying. They're not complaining. Well, they're not because it's not coming out of their pocket. It's coming out of the state budget. But then I had this moment, this epiphany the other day. I was at a meeting and asked an association this question. If there is a mandate, and say the premium is $100 and the mandate's $20, so the premium is $120. $20 should be paid by the state. But is the insurance company charging $120 and the consumer is paying $120 and the insurance company is getting $20 from the state? And they couldn't answer me. So I hope you followed me in that scenario. Or consumers being hurt by passing mandates. Yes, there's more benefits. They're getting more things paid, but the state's having to pay for it out of their budget. And how is that premium broken down? Just something to make you just think about it. I wanted to remind you about the HAFA Agent Summit, August 17th through 19th in the Monday Morning News. You can go ahead and register. And please, please, please book your hotel. It's a boutique hotel. There's limited amounts of rooms. HAFA has a small amount that we have booked. And if we need more, we need to know that ASAP. Go ahead and book your rooms. If you can help us with any potential sponsors. There's platinum, silver, and gold, and a new one called media. So maybe you know someone who would just like to be listed in our summit brochure. It's only $500. So if you know someone like that, every little bit helps us put on this summit, and we would appreciate your help. The speakers are going to be phenomenal. We've got some new folks coming in that I think are going to knock your socks off. You're going to learn a lot. Dean Mose from CMS has been invited. Some legislators have been invited. So I think that you're going to learn a lot from the folks that are there. Please join us in Austin and at the Benefits Pro Conference. We will have a booth there. HAFA will be there. Please come and join us. Please come and say hello. HAFA has a discount, so if you'd like to join us in Austin, there's a link in the Monday Morning News. You simply need to click on that, go ahead and register, and join us at the Benefits Pro. I talked to Anthem last week. You know that the Modern Healthcare article about the insurance companies not paying on the SEP, and Anthem was included. As I, forwarded the information that I had about Anthem, Anthem has come out full force, said that's not true. We are paying SEPs, and that's really not true. But I did talk to them. They are working towards doing a better job. They are still not paying SEPs in Kentucky and Connecticut that I know of. They did say that they were paying a bonus. If you don't get paid an SCP, then you do not have clients, and then you're not able to get a bonus. So it's kind of a conundrum. So tomato, you're not being paid an SCP, period. Very nice gentleman. It was nice to have a conversation and nice to have someone to talk to, but I have forwarded that information on to Modern Healthcare. They say that imitation is the sincerest form of flattery. I had to giggle because one of our members sent us some information from another association that was looking to recruit him, saying that they were the only association fighting for independent agents. Kind of our tagline, been our tagline since November 2012. I guess they liked what we have to say. Not only that, did I get another email from another member that this same association is now having a power hour. We all know HAFA Power Hour has been going on since the inception of HAFA. So we must be doing a good job if people are copying what we're doing. So thanks. I appreciate it. There is a webinar this afternoon at 2 o'clock by the NASHP about hospital cost transparency. If that's something in your wheelhouse, 2 o'clock Central Standard Time, join. Last week, we talked about Bright and the fact, first, we talked about the fact that they were not paying SEPs. Then we talked about the fact they were leaving states. And I'd like to ask, what's that going to do to the consumers that have Bright insurance? Are they totally leaving the state? Are they leaving those people in a lurch? Or are they just not writing new business? I think that a lot of insurance agents were caught off guard because when I sent this article out that was released by Modern Healthcare, most of our agents had no idea. They hadn't been notified by Bright. So I think that information is still trickling in on how that's going to happen, but be aware that it is. I just read this morning, hot off the press, that Louisiana's Attorney General Jeff Landry is suing United Healthcare for inflating prescription drug costs by billions of dollars for Medicaid. Very interesting. I'll keep you abreast about what that happens and if there's any states that follow suit. I also got an interesting email from one of our very amazing agents in New York, Sadler Hayes, about Maine trying to pass legislation about for a single payer that came to the tune of $220 billion. where do they think they're going to get this money? They talked about Vermont's failure to pass their single payer in 2019. They talked about the failure of Washington State's single payer and its complete failure in the last 3 years. We know that California, they have tried several times to pass legislation and haven't been able to pass that because of the cost. And then I kind of want to end today with a little giggle. Craig Gusson, our presidential board member from California, always talks about in our meetings about what happens in California will happen across the nation. So just beware and pay a close attention to his state. Well, I want to talk about Louisiana being the first state and just see how many states are going to follow us. Because the newest thing being talked about in our legislature is proposed bills being sexy and squishy. Now, I have to laugh because I call things squishy all the time, but that just means I look like want to squishy, you know, a little puppy's cheeks or something. But now Louisiana in committee, you can listen if you want, the bills are being described as sexy and squishy. So I'd like to say, California, you might not be the first in everything. Louisiana's the first in interesting adjectives. I hope you have a wonderful day. Please let me know if I can help in any way. Get involved in that Texas legislation. That's very important. That's something that we need to keep our eye out on. Let me know if you're not being paid in a particular state. I need to know that. I'm here. I'm available. Sending much love out to you, Rynell Nolan, President, CEO, Health Agents for America, the leader of the freedom fighters, the best of the best, the cream of the crop, the ninja warriors. Until next week.